Hello and welcome to my OMG Caretakers. I'm Tezzy Baldwin and I am your OMG Caretaker host. Welcome back. Today we're going to be talking about the various levels of care. What inspired this conversation is I just had a recent conversation with a family a few days ago, and one of the questions that was asked was, what are the different types of care and how do I know what my wife needs next? And so this inspired the conversation because I had to explain to him, the different steps and then what she could possibly be needing next. And so let's get started. First care is, or type of care is emergency care, and that's immediate treatment for urgent medical issues, often provided in emergency departments or urgent care centers. What happens? You're typically at home or out and about. Your loved one may experience some sort of emergent type situation that requires you to call EMS or take them to an emergency care department, and then it just ripples from there. You get them there, and so then they, look them over and establish whether they're critical or whether they can be just considered inpatient. The critical care is specialized care for patients with life threatening conditions, often found in intensive care units or ICUs, where continuous monitoring and advanced interventions are necessary. If they're not critical, they don't need an ICU. Chances are they then just become an acute inpatient um, or under acute inpatient care. That's hospitalization for severe but stable conditions that require close monitoring and treatment. Patients may be admitted for surgeries, severe infections, or significant trauma. That covers a lot. After your acute inpatient care, if your loved one needs surgery, then obviously surgical care would be next. So that's services provided to patients undergoing surgical procedures, including pre-ops and post-operative care. After they've come in, if they need a surgery that's been done, they've gotten them to a baseline point where the hospital and the physicians now say that they need the lower level of care from what they're currently receiving at the hospital. What that typically means is they're probably going to be looking to send your loved one to a short-term rehab or home with home health and or hospice. The short-term rehab is care for patients recovering from acute medical events, which may include physical therapy, occupational therapy, to regain functionality. Or they may need to continue to receive like an IV antibiotics for some type of infection, or they may need close monitoring for, maybe they have a wound that's needing care, or many things. They could now be on TPN, which is a nutrition, or have, just various amounts of things that require a short term rehab. From there, observation care is a level of care where patients are monitored for a limited amount of time. So, usually less than 24 hours to determine if they require admission or can safely be discharged. You'll typically see observation care in an emergency room. So, when we send patients out, um, they will be in observation, like I just said, for 24 hours or less. If they feel like what they came in for can be treated at an emergency room level, then they will treat them at the emergency room level. And sometimes that even includes bringing therapy to the bedside. If whatever they need, maybe they just need an order for therapy, they will have therapy come to evaluate that way when they do send to a short-term rehab or the referral to a short-term rehab. They have all the notes that they need in order to be able to get the next level of care at the skilled nursing facility. Short-term rehab, the same. They're both the same thing. So it's like potato kind of thing. Um, Outside of the observation care, that's really all of the levels of care that your loved one will go through and experience. If they come to you while your loved one is in acute inpatient care and say, we're going to give you a choice. We feel like the patient could go home with home health or could be sent to a skilled nursing facility. At that point, it really is going to depend on your level of care and comfort. What can you provide at home? What kind of resources do you have at home? Do you have home health set in place? If not, they will help you get the services set into place. If they are asking for a hospice, do you have a hospice company set into place? Do you have one in mind already? Have you already been working with one? Maybe, a neighbor or a friend told you about a company, whatever, but at this point, you start to have to make decisions on what am I going to do next? What's that going to look like? If I bring home my loved one in order to provide the services at the bedside at home, chances are, again, you're going to have home health provider services, hospice services, something like that. But that's only going to be for a set amount of hours. After those hours, please remember that the care solely lies on you. If you do not feel comfortable providing the care after the caretaker and the nurse leaves, and you cannot afford to have a provider in-house 24/7, or at least 14, 16 hours a day, and your loved one is just tasked with sleeping, and then by the time they wake up, someone's going to be there to take care of them, you really should consider short-term rehab, skilled nursing facility. I have a video on Nursing Home Compare, which is a lot of great information on how to choose the best short-term rehab, skilled nursing facility, long-term care facility for your loved one. I would caution you to please watch that video. If you have any questions, you can email me at tbaldwin@developme10x.com. Making the decision on where you're going to go for your loved one's next level of care should really be considered heavily, because it's a lot that goes into it. And remember, if it is a short-term facility, a short-term rehab, you're still going to end up bringing your loved one back home. But chances are that by the time they leave the skilled nursing facility, they are at maybe the level of care they were at prior to having to go to the hospital. Meaning that if maybe they had a fall, hit the head, something like that, they've gotten, 30 plus days of therapy, their gaits is steady, and they're walking better. You might be able to manage that care at home with little to no stress, meaning I would still consider bringing in home health even at that point, but the hours that will be given to you will really go with what you need, because your loved one doesn't need as much anymore. But please note that, watching changes of condition is extremely important the first 24 to 72 hours after you get your loved one back in home. Fevers, chills, unsteady gaits, which means that, when they get up, they're kind of wobbly. Anything to do with cognitive, not remembering things, not eating, that kind of stuff, obviously you return back to the hospital. Or if your loved one just left a skilled nursing facility and they've been gone less than 30 days, they may be able to return back to that skilled nursing facility for additional care. The best thing I would do if you have home health coming back into your home or coming to your home is have home health help you out with the documentation in order to do a readmit back into the skilled nursing facility, if that's what you would like to do. Most people don't even know that is even an option, but it is an option. So something to consider. That helps you to avoid having to go back to the hospital. But if it is severe enough, obviously take your loved one back to the hospital. And what I always like to, suggest is to have that nursing facility on standby, especially if you went there and you had a good experience and they did very well with, your mom, your dad, whomever you're taking care of with the care. You probably should call them back and get them, get your loved one back over there just to make sure that they're going to have the same people. Familiar faces are always important and helpful to your loved one. So that's all I have for today. I appreciate you tuning in. I hope this information was invaluable to you. I hope you found value in it. If you have any questions, please shoot me an email. More content coming soon. Thank you for tuning in. Have a wonderful day. Be blessed. And I will see you soon. Bye.